What's the status of this company right now? Are these tests available today, or they're going through clinical trials?
So we've studied over 2,000 patients with breast cancer already. We actually, working with scientists at Albert Einstein and MIT, have discovered the pathway that explains how metastatic disease arises in the majority of solid tumors, which is a novel breakthrough. We expect that our products will be on the market the first half of next year. We're actively moving forward to commercialize these products. In addition to having studied 2,000 patients with breast cancer, before we come to market next year, we'll study an additional 1,000. And we're also going to have data showing that our tests are also applicable to other solid tumor types as well. We're pretty excited about that.
Well, this is a big deal because I think it's going to truly revolutionize the way we're going to treat every patient. I think your goal is to really cut down on some of the unnecessary treatment after they're diagnosed with this. Because a lot of times, and we just saw in this recent article in JAMA, that the diagnosis of breast cancer may or may not be completely correct. You have pathologists discussing, is it atypical, is it a ductal cell, is it, what to do, etc. So given the fact that our biopsies, whether it's breast cancer or prostate cancer, is not really great, I think this is a great technology because you're going to reduce the overtreatment and just pick the ones that have possibility of metastasis. Is that right?
Yeah, that's exactly right. And that's an important article you referenced. In fact, I was quoted in some of the follow-ups. The criteria that we use to diagnose cancer and many of these tumors haven't changed in 100 years. We look under a microscope, we do straightforward staining, and we say it's a cancer. And we have to be able to do better than that with the advent of genetics, proteomics, epigenetics, molecular diagnostic testing. We really have to be able to give patients, their families, and their oncologists and surgeons more accurate information. Telling a patient they have cancer in 2015 isn't good enough.
Now, if people want to learn more about this, is there a site or any place they can go to learn more about you and the company or enroll in some of the clinical trials? Where do they go to get some more information?
So our website is really very well done. All of the science that underlies what we're doing is there. We have some amazing videos that will actually show individual cancer cells moving away from the primary tumor, changing their shape, and inserting themselves into the blood vessels that surround the tumor. And we call that video the moment of metastasis. It's only once an individual cancer cell gets into the blood vessel that the potential for metastatic disease arises. So the website is www.metastat, metastat.com. It's a really well-done site with some great videos.
Well, thank you very much for being here. It's a pleasure. We're also going to post all of this on my Facebook and Twitter, Dr. David Samadi. We want people to know about this. You're a great friend. You're always welcome to this show. And as this progresses and you come up with more data, this is your home. We want you to bring it, and we want to share it to a lot of people out there.
I appreciate the invitation.
Congratulations, and thank you for being here. We're going to take a quick break.